A Baton Rouge woman is lucky to be alive tonight.
Yeah, she had surgery for a heart condition many consider harmless, and doctors say she had a heart murmur. Phil Rainier has her story tonight in our 9 Healthline report.
Hello, my friend.
About 3 weeks ago, Ida Prejean had surgery to fix what could have been a deadly heart murmur. It's a heart valve problem that's harmless in most people, but for patients like Prejean,
they have a 50% chance of being dead in 2 years.
It was a stress echo test like this that helped doctors pinpoint Prejean's murmur. The main valve that pumps blood away from the heart had grown so narrow, it could eventually cause the heart to stop pumping. Prejean had been to doctors before, but never diagnosed.
And he told me there was nothing wrong with my heart.
Dr. Antoine Keller says it's not unusual for doctors to confuse harmless heart murmurs with ones that could be life-threatening. Under the stethoscope, the whooshing sound of blood pumping through a narrow heart valve can sound pretty much the same.
It causes turbulent currents within the blood vessel, and you can actually hear that.
Keller says it's patients who continue to have symptoms that need a closer look, but many times don't get it. Prejean's chief complaint was shortness of breath, and it was getting worse, not better. Without surgery to repair her heart valve, Prejean now knows she may not be alive today.
When it came time for the surgery, it's like it just didn't bother me of going through it, because it was more of a relief.
A relief to finally know what was wrong with her and to be able to breathe like a healthy person again. With Healthline, Phil Rainier, WAFB 9 News.
Other symptoms of life-threatening heart murmurs include chest pain, dizziness, maybe fainting. They're most common in people as they get older.